honored to introduce you today to Dr. Karen Kish. Dr. Kish is a board-certified breast surgeon at Nazareth Hospital and Mercy Catholic Medical Center, part of Trinity Health Mid-Atlantic. She received her medical degree from Drexel University College of Medicine and completed a residency at Abington Hospital, Jefferson Health, formerly Abington Memorial Hospital, and a fellowship at UMD-MJ and Robert Wood Johnson School of Medicine. Dr. Kish is currently a director of the breast program and program director for surgical residency at Mercy Catholic Medical Center. She also serves as chairwoman of the Cancer Committee and is assistant professor of surgery at Drexel University College of Medicine. We are honored Dr. Kish will share with us the importance of self-care as we navigate the new normal. Often women place our health and our self-care on the back burner and place our family's well-being first. Dr. Kish reminds us of the value of taking your health seriously and the steps we need for a better you. Welcome, Dr. Kish.
Hi, good evening, everyone. My name is Dr. Kish, and I am a breast surgeon who works at Nazareth Hospital. I have also duties in terms of education of our residents and our future surgeons, and have a passion for women's health and women's health topics. One of the things that I've been getting asked recently when I have patients who are calling or having a visit in the office have a lot to do with COVID, what has been going on in our community, and how that translates into how we're taking care of ourselves during this time. I think that women have come very far in terms of making a lot of strides, making strides with rights that women have, with our careers, with our family, with our lives outside of the home, and also with what we manage and take care of in the home and even as a head of a household. And I think that we as women have become the great masters of multitasking. If anybody has a smartphone, they can relate. We can organize schedules with the workplace and with home. We can log into our kids' schools. We can help schedule our kids in terms of activities and time with friends. But that can also mean that creates a very large to-do list. And oftentimes we're finding ourselves and our priorities at the bottom of that to-do list. As you may know, if you've ever been on a flight and you listen to the safety instructions, they tell you that you should be putting your own oxygen mask on in the event of an emergency before you help those around you. But I know an awful lot of women that would say, oh, no, I need to put that mask on my child, my family member first, and then I'll have plenty of time to take care of ourselves. So I think that it's a passion of mine to help women to recognize that we need to be taking care of ourselves and ensuring that we are healthy so that we can take care of those that depend on us. But even more so, modeling that behavior so our family members, our loved ones can see that we value that and we put importance in taking care of ourselves, and then they can learn that they need to be doing the same for themselves.
Yeah, we don't. I haven't learned that myself, so that's why I'm here listening to you, Dr. Kish. So, do you have any thoughts on with this COVID situation with what would be a suggestion of something that we should even pay attention to?
So I think that we can certainly talk about COVID-19 and what are our risks and what should we be doing to help lessen those risks. And, that's something that we've been hearing from a lot of different sources. Your doctors and your physicians are here to help you answer those questions as well. In terms of the pandemic, it's certainly always a good idea to be following our guidelines of our local public health departments, and that may be limiting gatherings of large amounts of people, wearing a mask, and making sure that we're maintaining social distancing. And in the ability where we can't maintain that social distance, we should be making sure that we're wearing our mask. If we're not feeling well, if somebody in our family is not feeling well, it's very important to reach out and contact your healthcare provider for advice. And that advice may be whether or not someone needs to be screened for symptoms or tested for the virus, along with, while we're going through that process, what do we need to do to help protect the others in our family or our loved ones? We know that the virus is there, but we also know that we need to keep on living as well. And so there's some things that we should be taking a look at in terms of our routine health care that we should really keep maintaining. With women's health care, there's a lot of things that go into women's health care, and the different ages and stages that we're at really help to guide us into what are some screenings or preventative health measures that we should be taking. And the pandemic doesn't stop any of that for us. So, you know, it may be that we're feeling healthy and we're feeling fine, and we need to just continue to check in with our primary care doctors, our gynecologists, to make sure those important screenings are happening. It may be that we still need to keep on track of vaccinations that we should be getting. We're going to be coming into the flu season very soon. One of the big questions in the healthcare community is, what is our flu season going to look like this year, when we potentially may be seeing more coronavirus coming back into the community? So it's even more important this year than others to really make sure that we're getting a flu shot, whether that's at our doctor's office, whether that's at, you know, a local pharmacy or other health care provider. Other vaccines also play a role. So as we age and women are older, we need to consider, should we be having vaccines for pneumonia or shingles? And again, we don't know what the fall will bring. We don't know what the winter will bring with coronavirus. So being prepared is going to be your best bet to really get through this season as healthy as possible. In addition to vaccines and prevention, there's screenings. I myself am a breast surgical oncologist, so I do treat patients that have breast cancer, and that's another thing that is for certain. Certain diseases don't stop because we're going through a public health crisis. So just because we're dealing with COVID-19, it's still very important that if you have a concern, if you find a lump in the breast or you have a new symptom, that you're definitely reaching out to your doctor to have that checked out. Services like mammograms are really still ongoing, and so people can still have their yearly mammogram, which is a very important way of keeping on top of their breast health and catching any suspicious changes early. Along with that, having your colonoscopy. Colonoscopies haven't stopped either. So it's very important in terms of your colon cancer risk, again, if there's any symptoms that you're having, to have that checked out, but to continue scheduling those screening colonoscopies, looking to find any kind of worrisome problem in its earliest stages when that's something that's easier to treat.
I'd like to go back to the vaccinations, and my question is, when you mentioned the shingles vaccination and pneumonia, is there a guideline on an age that's there? I'm asking because maybe I'm at that age now, that there's an age where to start considering taking those additional vaccinations?
So with any kind of vaccination or screening, there are age guidelines in terms of by the decades, 20s, 30s, 40s, 50s. But it's also important to note that somebody in their 40s may have other medical conditions that could put them at a higher risk for developing a problem, or if they were to develop pneumonia or shingles, they may have a more complicated course. So while we talk about the shingles and the pneumonia vaccines, and we typically talk about that as women are older, maybe in their 60s or 70s, there may still be some times when you're younger and you may benefit from that. So it's really important to have that discussion with your primary care doctor about what is my risk and what are the things that I should be doing to help lower my risk of certain diseases or conditions.
Okay, that's good to know. So when you mentioned, you didn't mention 50s, so I was just, so 50s is that decade, I think, that is so transient.
A lot of things change.
So you're touching on the points that we have to maintain our conversations and making sure our testing is continuing and focusing on our health. So now that we are in this strange environment of we're not necessarily always going to a doctor's office or what have you, and healthcare itself has changed to a virtual online experience. Is there any advice that you give to somebody, can you give to somebody who may be intimidated by that process? I'll say, oh, if I can't go to the office, I don't want to talk at all, or I only want to speak in person. Is there still that value? I only want to speak virtually. Is there still that value to making sure that there's an in-person visit with a physician?
Absolutely. I can't agree more that there is a wide variety of comfort levels. And, going through this pandemic, we were all put into a shutdown. We were all isolated. Many people were turning and working from home. They were maybe not even going out to the grocery store, having things delivered. We started to see improvement in the coronavirus cases in the city. We started to see our local governments opening up and bringing us back to some activities. But just because someone says that something's safe doesn't mean that you automatically felt comfortable in doing that. And I think that the important thing when it comes to healthcare is that you need to be comfortable. You have to have a provider that you feel comfortable with. You have to have that fit. And a good provider would be able to give you those options that you need to feel safe and to continue that care. So we did definitely have a lot more telehealth visits. It may have been a video visit, it may have been a phone call, and that certainly was something to get used to too, because technology is involved. It may be a smartphone, it may be a laptop that you're using. You needed to make sure that you were in a space where you felt comfortable, that you could talk about some of these sensitive issues. In a lot of cases, providers are still giving that option of telehealth. But it is important to note that there are some times when it's just hard to really assess or make a good judgment through a video screen. As a surgeon, it's very hard for me to do certain things through a video screen. So again, that provider needs to work with you. And if something needs to be discussed in a telehealth visit so that maybe testing could be ordered or a plan is made, that's a good start. But sometimes you might need to come into the office. Working in healthcare, I can tell you it's been a journey these last few months, and where we are now when we're seeing patients is very different than where we were in February of this year. We have worked very hard as a healthcare organization to make sure that we are following all the guidelines that we need to, that patients are coming in at timed intervals, so you're not sitting in a waiting room. You're really being directly brought in, seeing the provider, and being able to be checked out in that same space and then go about your day. Protocols for cleaning are followed very rigorously. Examination room spaces are rotated so that there's time for that cleaning and disinfection. We definitely screen people who are coming into the office so that we know if there's any risk factors, that they may have exposure, they may not be feeling well, and we can direct you to have the proper care that you need or the proper testing. The same goes when you're coming into the hospital setting for x-ray tests, for a procedure, or for a surgery. We utilize testing for the virus in certain ways to ensure that if you were to undergo a procedure and you were carrying the virus and didn't even know that because you weren't having symptoms, we can test and make sure that you're not carrying that virus so that we don't expect any complications or problems in your recovery period. On the same hand, testing coming in for a procedure lets you know that the people coming before or after you have already been tested and cleared as well. So that's really minimizing the risk that you may have of being exposed. And as I tell my patients, every time we leave the house, we can risk exposure to coronavirus, but what we're doing is trying to minimize that as much as possible. And that should help to also make somebody feel comfortable coming into the healthcare setting.
And I would like to just note to those who are viewing this and as our Women in Business online conference is an on-demand product that we are recording this in September, early September just right after the Labor Day weekend. So we're discussing where we are at the current moment. But when knowing what we've been through since March and what we've learned since then, and have the anticipation of what could happen in the fall and the winter is I think important to point out where we are, how we're speaking about our current situation right now. And I'm just going to touch on a regional level that I know Northeast Philadelphia was a hot spot there for a while, and had a lot of the cases in Northeast Philadelphia, and citywide, the cases have dropped dramatically, very fortunately, and so Northeast Philadelphia, Nazareth Hospital, you were probably an epicenter of a lot of chaos that was going on. And how has that, in your position, helped you to navigate and for preparation for the fall and the winter?
Oh, I think that's a great topic to discuss, because when we started hearing reports of this novel coronavirus in January and February, and we weren't certain if and when this would be something that we would see, we were forced quickly into protocols to really cut back on services, one, to help reserve healthcare resources that would need for those who are ill, two, to really, again, make sure that we were not having a problem in terms of people coming out and having exposure, getting ill. We now have learned so much in terms of how we can mitigate that and mitigate risk. So in the hospitals now, we definitely, like I said, have testing that's done prior to certain procedures or surgery. We have entrances in hospitals that are dedicated to COVID-free entrances, meaning that we are making sure, just as much as a well child and a sick child waiting room in a pediatrician's office, we have those spaces within the hospital. We have learned so much in terms of transmission of the virus, how we can go about taking care of patients that are ill with the virus, and protecting ourselves and protecting those around us. So I do think that we're in a much better spot for any resurgence of the virus, because we have certain policies and protocols in place and things that we've learned that can help us to take care of patients, but also continue to take care of the other things that we need to. Having the emergency room there for all the things that continue to happen. Somebody has chest pain or has an accident or needs to be seen for a reason that's not related to the coronavirus, but still have that quality care given in a safe way.
Do you believe that protocol will continue as time rolls on? At one point, the virus will be contained, we'll have a vaccination, but do you think a lot of these steps is part of our future?
I think that a lot of this is here for our near future. One of the things that I see and I notice, some of the things that we do in our day-to-day life now are things that we really would have recommended during, say, the flu season. If you went out to the market, wiping down the handle of your grocery cart. If you're not feeling well, making sure you're staying home. If you have certain health conditions, making sure that you're not around others who are sick or not feeling well. And so a lot of that is what we're carrying into this pandemic too. And we may not be realizing that because we have the addition of wearing masks, which we aren't used to wearing here, and the idea of social distancing, and we're reinforcing that because it does make a difference. But some of these things are practices that we've always been recommending. So I think that some of this is going to continue into the future. It may not be all of it. By the time we reach a point of a vaccine and developing more immunity, we may be able to relax on some of these measures. But I think that the hand washing and the sanitation of some degree would stay.
I've been mocked by my children for 30 years for having very large containers of hand sanitizer in my house at all time. Guess who's laughing now? So I agree. I think this has now become part of our core. So going back a little bit to women's health. So we've talked a little bit about making sure that you're continuing your screening and your relationship with your physician, your primary care physician, your gynecologist, or whoever is important in your life to making sure you're healthy. What would you suggest that we as women can pay attention to because we have been in lockdown for a period of time, that there are statistics where there have been some unhealthy habits that have been developed, and present company included, that some unhealthy habits that have kind of crept into where every night was Saturday night. So popcorn for dinner was probably not the best choice. But how could you bring women back to focusing on getting out, taking a walk, and making sure that you're making good choices?
Absolutely. There are three big things that come to mind when we're talking about that, and that's getting active and paying attention to our healthy eating and dietary habits, and a very important one to talk about too, which is really taking care of our mental health. I am a mother of 3 daughters who have been very active, obviously juggling career, juggling home life. And when this pandemic came, this was a big change, as it is for a lot of women out there. We may have been used to going out to restaurants or spending time traveling, or maybe just taking care of our family and making sure they're getting to their activities that they need to. And all of that came to a halt. It's been wonderful to be able to have some time to kind of take back and take a look at what we really hold dear and valuable to ourselves. And it's a really great time to be able to reevaluate that and say, well, these are things that are important to me. And I do look forward to when we can go to a restaurant and dine indoors or travel freely again. But what are some of the things that we can make just small changes in our life to help get back to some of those healthier habits? I think that a lot of families that are dog owners out there, I saw a lot of different memes saying that the dog was tired of the 15th walk in the day because that was the only activity that we could be going out and doing. But getting active is a really great habit to build now, and we do have the time for that. And when we talk about being physically active, it's really just trying to get to a healthy weight and maintain that. And so 30 minutes of an exercise a day, and that doesn't have to be in one chunk, that can be broken up into 10 minutes. That is a really great way to make sure that we're looking at our health. We can lower our blood pressure, our cholesterol, keep our bones strong. We can really be, again, getting and achieving that healthy weight. But it also does great things for our mood and helping, if there are signs of depression that we see, getting out, getting active, that is a great way to help yourself with that. There's also been that kind of running joke going around that much like the freshman 15, there's the notion of the COVID-19, and that would be the 19 pounds that we've gained watching things on Netflix and Amazon movies and having some of those snacks with easy access to the pantry. It's, again, really something to be mindful of and really take a look at, what are we eating throughout the day, using some of those guidelines that we have from the Healthy Plate initiatives, making sure we're looking at lots of fruits and vegetables, grains, proteins. I'm not saying to eliminate snacks, but to have things that are done in moderation. And then lastly, looking at our mental health. I think that is one of the biggest things that we have seen and should be looking at through the pandemic. There have been a lot of studies in children when we talk about them being out of school and in a virtual environment, but also within people who are, again, isolated at home. You used to be able to get in your car and go to the office and have adult interaction with others outside your family and then come back to your home. So it is important to really make sure that we're making those connections. We're calling our friends, we're checking in on them, we're maybe going out into the neighborhood on walks. We might be having interactions with our neighbors, check in with our coworkers. We're having many more Zoom meetings and using those Zoom meetings as interactions as well. And as things progress and it's safer for us to get together in person with different people, looking for those opportunities. So the other thing is that with isolation comes, we need to be very careful in monitoring, are we feeling safe in the home? Is there anything that we're worried about? Is there anything that we're worried about in a loved one? And making sure that if there is a need for it, that you're reaching out for help. And that's another great reason that your primary care doctor and your healthcare providers are there, is to really help make sure that you're getting any kind of resources that you would need.
I was gonna ask that question, because I think that identifying the fact that we're all, my favorite saying since this pandemic started, where we're all in the same storm, but we're not all in the same boat. And identifying the fact that everybody's boat is different and dealing with the challenges. And I think that if anybody is feeling overwhelmed, depressed, emotionally down, or what have you, if they live alone, how do they identify that? Because you get caught up in your own head, in your own world. Or if you have a loved one, how do you make sure that you get help? You touching on speaking to your family care physician is really, it's critical.
Absolutely. And, it takes a village. It takes a village to raise a family, but it takes a village to be part of a community. And there are very many people right now dealing with a lot of those issues that in other times, not in a pandemic, have been feeling quite fine. So I think it's really important, again, to make sure that if it's something that you're feeling, you're reaching out to the supports in your life, whether that might be other family members, other friends, it may be a religious group, or it can be your doctor. And on the other side, some people may recognize that in their family member or a loved one, and it's an absolutely equally important idea to make sure that you're there as a support and also helping to make sure that person is finding the help that they need.
Do you have any advice moving into this next season with the anticipation that we may have some challenges because of the fall and the winter, just because of the fact that the virus thrives in a colder environment, et cetera, et cetera? Any advice that we can now prepare for ourselves, taking that mask on the airplane and putting it on ourselves now in order to prepare for the few coming months?
I absolutely do. I think going through the pandemic personally, I also took a look at my own care, and they say doctors make the worst patients, but I definitely made sure I took this time to have those routine health screenings done, because, in April, May, and June, all of a sudden we had, less of that opportunity, and we don't know what might happen again. I am very hopeful that we'll be better prepared to deal with another wave of the virus, and so we won't see some of those services closing down as maybe they did during the height of the pandemic, but there's no time like the present to make sure that you're making those appointments, you're being seen by your provider, whether that's telehealth or in person, you're having your screening tests done, because we really can't take care of those that depend on us unless we ourselves are healthy. And looking at what we faced during that pandemic certainly can make you become a little introspective to make sure that we're keeping ourselves healthy. I think that the other thing to know is that, it's really not the time to ease up on some of these things that we're doing. Like we said, wiping off that grocery handle, using your hand sanitizer, washing your hands, wearing your mask in the appropriate settings. It's really a community effort to make sure that we're doing everything we can to keep the most vulnerable in our community safe. It would be great to know when we have a vaccine that's coming out, and certainly listen to your healthcare provider as to who should have that vaccine. When should you have that vaccine? There are vaccines that are going through very rigorous trials, so any vaccine that's coming out would be a tested and safe vaccine to have. And also, again, making sure we're doing things like getting our flu vaccine to keep us healthy during this season. And one of the important things that I would say is to know that I don't think that this will be our permanent future. In other words, making sure that you're realizing that there will be a light at the end of the tunnel. Where we are right now in September is much different than where we were in April. And so months down the road, we may be in a better place than we are even today. So having that hope and being able to draw on that positivity can really do a lot to get you through a tough time.
That's an excellent point, Dr. Kish. That is an excellent point. There is a light at the end of this tunnel, and we will get through this. And humans were very resilient. And to your points of the general don't touch your face, wash your hands. I remember in the very beginning them focusing on the fact that make sure you wash your thumbs. And I never thought about that. I'm like, I wash my thumbs. Maybe I wasn't washing my thumbs. So I think that there's really some good habits that have come from this too.
Absolutely. I sing happy birthday to myself probably 30 times a day while washing my hands. So it's another mood booster, right? Pretend every day is your birthday.
It is. Excellent. So just want to touch on the family aspect of things for us to pay attention. Obviously, we need to make sure that we take care of ourselves first and foremost if we have those that are relying on us. But is there any suggestion that you may have to just pay attention, focusing more on the children, because children are going through this in a much different way than we as adults who've had an entire lifetime of our old normal. So how do you suggest that we focus on our children, pay attention to what they're feeling?
So this is something that's very close and dear to me. As I mentioned, I am raising 3 daughters that are in elementary and middle school. And this became a challenge in the spring because there are 3 different personalities in the house at any given time, and they weren't all hitting those highs and lows at the same time. So you have to be very perceptive. And it could be something as subtle as somebody acting out in a way that they hadn't before, or it could be your high-performing student at school is all of a sudden maybe not making the grades that you would be used to. And really paying attention to those subtle clues and having that conversation, just checking in. How are you doing? How was today? Is there something that you did that was really great that you want to tell me about? Or on the other hand, was there something that really wasn't that great about today that you want to maybe see if we can work on a solution to? Finding that time to connect with them on a one-to-one level was really helpful because, again, they weren't all experiencing these things at the same time. The fall coming and many students not returning to school and dealing with technology and the virtual classrooms is another time that is stressful, not only for the academics and the kids wondering if they're learning or are they doing things right, but also because they're really missing their friends, they're really missing the classroom environment. And just as much as we get in the car and go to work for adult interaction all day long, they're used to getting on the bus and going to school and dealing with their peers all day. So it's important to help them try to make connections, however you again, following the wearing a mask and social distancing is going to keep you your healthiest when you're doing those activities. And also encouraging them to understand that there's still normal out there. There's still stores, there's still people, toys are still there. It's not that the whole world has disappeared and it looks different. And those sorts of things can go a very long way in helping kids to know that although we're dealing with something different right now, again, won't always stay that way. And there are things that are still going on that are normal.
That's excellent advice. I know that the puzzle companies have increased their production. A lot of people were purchasing puzzles through this whole, and friends of mine who have smaller children, they had it as a family gathering effort and a puzzle night. So there is definitely some nuggets of sunshine of having everybody together. But and then there are the parents that now have the college age students that are now learning from home and missing out on that empty nest syndrome. So it's definitely something to be navigating.
Absolutely.
Yeah, so do you have any other closing words of advice that you would say that a golden nugget that somebody can put into their lifestyle immediately as soon as they hear this session?
I think that we just need to take this pandemic almost as an opportunity to take a step from our busy, packed lives that I know many of us have. And again, really take a look at what is it that I value and I hold closest to me and build upon that. Use those resources, use this time to make new connections in the family, to build new habits and rituals within the family. And that itself can help with so many things that we've talked about tonight in terms of being healthy and staying healthy and keeping ourselves mentally healthy and active.
Great, great, great words of advice. And get your exams.
Absolutely.
Get your exams. Schedule them now. So, Dr. Kish, I cannot thank you enough for your time today and your expertise and just your words of wisdom and a sound voice for those of us to turn to. So we really appreciate your time and your dedication to the Northeast Philadelphia community through the great works of North Nazareth Hospital. And just thank you very much.
Thank you for having me. It's been my pleasure talking with you tonight.
That's great. I would like to take a moment to thank our generous sponsors. Through their support, we are able to bring you quality programming and a virtual networking experience. I'd like to thank our corporate sponsors, Philadelphia Federal Credit Union, Parks Casino, TD Bank, Marshall's Distribution Center, Philadelphia. I'd like to thank our executive sponsors, Chorus Services, Holy Family University, Inverse Paradox, Jefferson Health Northeast, Nazareth Hospital, Northeast Family YMCA, PICO, Philadelphia Gas Works, Philadelphia Industrial Development Corporation, Rivers Casino, St. Basil Academy, and Witham Smith & Brown. I'd also like to thank our media sponsor, Northeast Times, our production sponsor, Viral Ideas Marketing, and our session sponsors, Fast Signs of Northeast Philadelphia. Please take a moment to reach out to our sponsors and share your positive experience as a subscriber of the 2020 Women in Business Conference. Thank you very much for subscribing, and we hope you enjoy our programming.